Good afternoon. Today we are talking about breast reconstruction revisions. So you've already had breast cancer, already had your mastectomy, and now you want to have an edit to your procedure, specifically switching your implants from the under the muscle position to the over muscle position. I'm Dr. Dumestri, board certified plastic surgeon. So this is actually a really common presenting concern for patients who come to see me for reconstruction revision. So a little bit of backstory. Way back in the day, reconstruction first started by placing the implants in the same position as the breast gland, which is above the pec muscle. Now, when they did that, they had nothing wrapping the implant, and they found they had huge rates of infection and capsular contracture, so a hard thickening of scar tissue around the implant. Then it was discovered that could be avoided by placing the implants fully in the submuscular space. So instead of sitting on top of the muscles, we would create a space underneath the pec muscle, often using some of the undersurface of the muscles here as well, so that the implant was entirely confined to the submuscular space. Now, this improved the rates of infection, skin death, and capsular contracture, but it came at the cost of aesthetics. So when everything is completely under the muscle, it's really tight, the implants sit a bit unnaturally high, and they sit really flat and round on the chest. You also get a lot of animation, so anytime that you're activating your muscles, you get some deep wrinkling all over the chest wall that can even be painful. Then came the advent of ADM, or acellular dermal matrix, which I always say sounds grosser than it is. It's taken from human skin, the undersurface layer of your skin, which is called the dermis, and gives you strength and stretch. So once that product became available, we were able to do partial submuscular coverage. So only the top portion of the breast implant is covered by muscle, and then the undersurface was covered by the sling. This allowed for much better aesthetics because that ADM sling was able to provide some roundness to the breast and not have the implants as stuck on, while also having similar rates of that capsular contracture and infection. So then people said, okay, now we've got this substance, it's a lot more available. What happens if we put the implant on top of the muscle altogether? Because people with the partial submuscular coverage still complain of that animation. This is something that you'll see on a cosmetic breast augment, like you'll see the implants bounce, but it's not disfiguring and it's not typically painful. In the reconstruction setting, because your skin is so thin following removal of your breast gland, that animation can be really, really visible. So then they placed the implants in the above muscle plane, which is the prepectoral plane, wrapping them with the ADM, and found that this gave really acceptable results as far as capsular contracture, infection, all of that. The downside of placing them above the muscle is that now you have that little less bit of coverage on top of the implant, so you can have a bit more implant show or implant rippling. Those are the folds that form in the implant when it sits there against gravity. So to counteract for that, we just do a bunch of fat grafting. So I transfer liquid fat from liposuction of any body part, inject it into that mastectomy skin to thicken it up and conceal the ripples. So now women who have had their submuscular recon, they've had those issues, pain, animation, maybe a poor positioning of their implants, come in to see me and say, am I stuck in this position or can I change? And the answer is absolutely, we can change it to the pre-pec above the muscle plane. Often involves 2 surgeries to reach your most aesthetic outcome. So in the first surgery, I remove your old implants, wash everything out really well, and then I repair your pec muscle right back down to where it started. I then place the implant wrapped in the ADM onto your chest wall in that nice position, and then typically you'll have drains for 2 to 3 weeks to help everything stick down, suction down to that ADM. Now, I often cannot do fat grafting on that same day, and that's because the area is too thin and there's no capsule to hold the fat in. Then everything settles out for a period of 3 to 4 months, and then we go back for the second surgery, which if everything is in a nice position, all I'm doing is that liposuction and fat grafting to the area. This is a very high patient satisfaction surgery. It completely eliminates the animation. It can put the implants in a bit more of a natural, slightly lower position, and patients are often very happy. Let me know if you have any other questions about this in the comments. Have a great day.